Hi legend viewers, for the staff nurse entrance exam in the subject of microbiology, we will be discuss about the topics are already we have discussed about bacteria, what is mean by bacteria, how many types of bacteria are there, then what type of staining techniques are useful to demonstrate the bacteria, then what are viruses, how many types of viruses, and then what type of diseases are caused by the viruses. Then today's topic we will be discuss about parasites. Parasites. What are parasites? Parasites are the organisms which are able to cause diseases. Then the study about parasites is called as parasitology. The parasitology is a science which deals with the study of protozoans and platyhelminthes or helminthic organisms, all will be included. Helminths are included in the parasites. So here in this medical parasitology will be explained. Medical parasitology will be explained by the pathogenicity of parasitic diseases. Here, before going to this, here when it requires host and parasites, whenever the parasites are able to cause disease, when the availability of the host, when the host is available, host is an organism which is able to provide the shelter and nutrients to the parasites. Here the host is providing the nutrients and shelter to the infective organisms such as parasites. Here the parasites are depends on the host to get the shelter and nutrient. They receive the nutrients from the host. So these parasites they complete their life cycle. If they want to infect the disease, it will be complete the life cycle by the asexual and sexual mode. For that purpose, it required two types of hosts are required. They are definite host and intermediary host. Hosts are required to complete their life cycle. For example, whatever the organisms that will mainly these parasitic infections are fecal-oral contamination, then the fecal-oral contamination of food and water whenever we consume, that will be enter into our digestive tract and that will be able to cause the diseases in the intestine or stomach, and amoebic dysentery, for example amoebiasis, which is caused by the Entamoeba histolytica. When here the main source is man, and the mode of infection is contaminated food and water. The infective form is cyst formation. These cysts are found in the food whenever we consume, that will be enter into our stomach and then they able to cause disease as a diarrhea or amoebiasis. All the symptoms will be shows by the Entamoeba histolytica. The treatment for this Entamoeba histolytica we have to take as a medicine metronidazole, which is a effective form to reduce the amoebic dysentery. For example, like this mode, that will be here it require definite host and intermediary host are required for their completion of their life cycle. This is about for what we have discussed. What are parasites? Parasites are the organisms which are able to cause diseases. Based on the type of diseases, if we want to study the parasites, that study is called as parasitology, which is a science which will be explained about with the protozoans and helminths. These parasites will be explained about them. Protozoans are the single cellular or unicellular organisms. Unicellular organisms, and platyhelminths are multicellular organisms. Multicellular organisms are categorized. Then coming to what is medical parasitology means, which is explain about the pathogenicity of parasites based on the disease conditions. Parasites are when the suitable host is available, then only they can able to cause diseases. What is a host? Host is an organism which is able to provide the nutrients and shelter to the host, whereas parasites are receiving the nutrients and shelter from the host. This is the interrelationship between the host and parasite. But parasite will be complete their life cycle by depending upon the host. It will be complete by the two intermediary hosts are required to complete their life cycle in the mode of sexual and asexual mode of completion of life cycle will be taken with the help of two hosts are required, and the first host is called as definite host, and intermediary host also required. Intermediary host most of the cases is a man, but all the definite host, for example in a plasmodium or malarial, it require anopheles mosquito. Like different type of intermediary host and definite host are required to complete their life cycle of these parasites. Then how the mode of transmission is, mainly when infected or contaminated food we consume, that will be goes into the stomach, and that will be able to cause amoebic dysenteries. Amoebiasis will be taken place. How can we find this amoebiasis? Mainly inverted flask shapes lesions are appeared on the small intestine and large intestine. Here inverted flask like lesions are appeared in the large intestine, and then diarrheal symptoms, frequent diarrhea will be appeared. Then the source of infection is man. The mode of transmission is food and contaminated water, and that is fecal-oral. The infective form is cyst of Entamoeba histolytica. Then diagnosis is, how can we diagnose these parasitic diseases? We have to collect the blood from the patient, then we can observe that we can follow the laboratory procedures, then we can see the trophozoites and cyst in the stool sample. Blood and stool sample will be collected from the patient, and then we can observe the trophozoites and cyst in the sample. Then how can we treat? By giving the metronidazole medicines to cure of this disease. This is the type of treatment will be given to the patient to cure of diseases such as protozoan parasites, such as Entamoeba histolytica, and which causes the disease is amoebiasis. Then Giardia lambelia is causes giardiasis. Then Trichomonas vaginalis causes trichomoniasis, are the example of diseases which are able to cause diseases of which are included in the protozoan parasites.